Hello, I'm Stuart Butler. I'm Vice President for Domestic Policy at the Heritage Foundation. I'm also a member of the editorial board of Health Affairs, and I lived under the British National Health System for half of my life. This is what Vice President Biden is saying about people who oppose the President's healthcare plan.
The biggest myth of all is that our health insurance system is just fine, that there's no serious need for reform. I heard one opponent of reform in Congress say, and I quote, "This is not a major issue among the American people." Nothing could be further from the truth.
As you heard, the Vice President and the White House are saying that people who oppose the President's plan really are quite happy with things as they are today and don't want any change. That is absolutely untrue, and it's insulting. I've spent 30 years of my life, as others have done, trying to fix the problems of the healthcare system. We want to reform the system. We just don't want to do it the way the President and the White House and the Congress want to do it. They want to set up an army of czars and boards to micromanage everything in the healthcare system and tell doctors and hospitals exactly what to do. They want also to set up a public plan, like the plan that I lived under in Britain, that would eventually drive out of business Americans' favored private healthcare insurance. And then they say that if you're satisfied with what you have under the current system, nothing will change. That is absolutely untrue. Of course things will change under the President's plan, and it's insulting to Americans to say it won't. That's why people around the country are up in arms and are opposed to what he's trying to do. We should certainly fix the problems of the American healthcare system, but we must recognize that we can't do this all at once in one huge piece of legislation. The American healthcare system is 1/6 of the entire US economy. If it was a separate country, it would be the 6th largest economy in the world, larger than the entire economy of Britain. We can't possibly solve that in one piece of legislation. So we've got to do it in stages. And as we do it in stages, we can agree on steps that need to be taken and get broad bipartisan support for things like allowing the states to take the lead in solving these problems. We should have 50 laboratories solving the healthcare system, see what actually works, learn from each other, and let people who are not satisfied with what's going on in their state buy insurance across state lines in a state that they prefer. Let them do that. Also, we've got to fix the tax treatment of healthcare. Right now, somebody like Bill Gates gets an unlimited tax break for as much health care as his company provides him. Meanwhile, many other people have no tax benefit at all because their company doesn't provide coverage, or if they go outside and buy coverage themselves, they get no tax break. That needs to be fixed. We need to reform the basic tax treatment so that all taxpayers get equitable help to get health insurance. We should do that. We can get bipartisan support for doing that. We should scrap the current legislation that we're working on the Hill and start all over again and take these kinds of steps. To see more videos like this, go to fixhealthcarepolicy.com.